All right, welcome to the deep dive, everybody. Today we're going to be diving into something really critical and really exciting, and that is the world of pharmaceutical quality control. We're talking about the cutting edge stuff. For a long time, we've relied on those tried and true methods to make sure that our medications are safe, that they work like they're supposed to. But now, get this, there's this whole wave of innovation coming at us with new analytical technologies. I mean, it's like a tsunami, and they could totally revolutionize how we look at quality control in this field.
Yeah, what's really grabbing my attention with all this is how these advancements have the potential to really tackle some of the big challenges we've been wrestling with for ages.
Exactly.
Like, think about it. What if we could analyze these drugs way faster, at a fraction of the cost? And even in places we never even thought possible before.
Right.
I mean, that's what these new technologies are starting to make a reality.
That's huge, right? Imagine a world where we're not waiting forever for new meds to come out because quality control is so streamlined. Or think about the cost of medicine coming down. That could mean more people can actually afford the treatments they need.
Exactly.
And then there's this whole idea of being able to do these quality checks anywhere. I mean, that opens up some crazy possibilities.
So to really wrap our heads around all of this, we've pulled together a bunch of research, stuff on drug development, these super advanced analytical methods like mass spectrometry, the whole regulatory scene, which is obviously a big deal, and of course, how these drugs are actually made.
That's right. And what we're aiming to do today is to sort of sift through all this info, pull out the real gems. We want to understand how all these tools, like we're talking microfluidics, ultra high resolution mass spectrometry, portable spectroscopy, and then, of course, the AI thing,
Right.
machine learning. How are these things going to totally revolutionize the future of pharmaceutical quality control? It's like we're standing at the edge of a whole new era. I completely agree. So let's jump right in. First up, we got to talk about microfluidics. Now, when I hear that word, I picture these teeny tiny labs, like almost microscopic on a chip. Is that even close to reality? And what does that kind of miniaturization mean for pharmaceutical QC?
Oh, you're right on the money there. That's the essence of it. Microfluidics gives us this amazing ability to run these complex tests, the kind we need for quality control, but on a super small scale. And it's not just about making things tiny. I mean, that's cool and all. But the real game changer is the potential for making everything way more efficient.
Okay. Yeah.
Like, imagine walking into a QC lab and seeing that they've slashed the amount of reagents they need for a crucial test by like 90%. That's a huge cost saving right there, and that frees up budget for other important stuff, like research into new drugs.
Yeah.
And because we're talking teeny tiny volumes here, things happen a lot faster too. Reactions just zip along, and that means we can automate a lot of the steps with much less hassle. Now, it's true that our sources don't give us a ton of examples of this tech being used everywhere in pharmaceutical QC just yet, but come on, we can see where it's heading. Look at how successful it's been in vitro studies and high-throughput screening.
Yeah.
Those are areas where speed and efficiency are king, and that's exactly what microfluidics delivers.
So maybe we won't see microfluidic chips replacing entire labs right this second. But the idea of doing more with less and doing it way faster, that seems like a perfect fit for pharmaceutical analysis. It's like we're taking this huge, powerful lab and shrinking it down to the size of, a postage stamp.
You got it. And this whole miniaturization thing, it's not just about saving money on those reagents. It's also about running tons of tests simultaneously. Like, you can really ramp up your throughput and generate data at lightning speed.
Okay, all right, so that's microfluidics, super cool stuff. Next, we got to talk about ultra-high resolution mass spectrometry. Now, that ultra-high, that's got to be more than just a fancy marketing term, right? I mean, what does that level of detail really get you in pharmaceutical analysis?
Oh, it's definitely not just a buzzword. It's the real deal.
Yeah.
We're talking about being able to tell the difference between molecules that are almost identical in mass. Like, imagine being able to tell apart identical twins just by looking at one single hair follicle.
Wow.
In pharmaceutical QC, this level of precision is crucial for pinpointing and measuring even the tiniest impurities that could be harmful, but that older methods might completely miss. One of our sources, the one on ADME enabling technologies, it really stresses how critical this technique is for accurately identifying drug metabolites. Those are basically the compounds that your body breaks the drug down into. And of course, knowing exactly what those metabolites are, whether any of them could be dangerous, well, that's absolutely essential.
Yeah, for sure. So it's not just about knowing what the main drug is. It's about getting this super detailed fingerprint of everything else that might be lurking in there, even in tiny amounts, and understanding what those byproducts might do.
Right. And, the Handbook of Isolation and Characterization of Impurities, that one goes even deeper. It points out that this ultra-high resolution mass spectrometry lets us analyze all sorts of complicated compounds, even the ones that don't evaporate easily. And it can break them down into these characteristic fragments.
Okay.
They call it, collisional activation spectra. It's like gently bumping the identified molecule into other molecules so it breaks apart into smaller, more recognizable pieces. Kind of like if you had to figure out what an object was just by looking at the pieces after it's shattered. That kind of detailed structural information is pure gold when it comes to making absolutely sure we know what those impurities are and that they're within those super strict regulatory limits.
So it sounds like it's not just for routine checks, but also when something unexpected pops up or if you're dealing with a brand new drug molecule that's really complex.
Exactly. Having that level of detail gives you way more confidence in the purity and the overall quality of the drug.
Okay. Now, portable spectroscopy. This one sounds like it could really change the game in terms of where we can do quality analysis and how quickly we can do it. So what's the big deal here? What's all the buzz about?
The core idea is to take quality testing out of those central labs and bring it to where the action is. Think about it. Running quick tests on raw materials right when they show up at a manufacturing plant. Or imagine monitoring those critical parameters during production, like in real time. Now, it's true that our sources don't give us a ton of specifics about how portable spectroscopy is being used for pharmaceutical QC right now, at least not in the exact scenarios. But there's this huge demand for faster, more efficient analysis, and that's only getting bigger, especially when you factor in things like dissolution rates and bioavailability. That's how quickly the drug dissolves and gets absorbed by the body. And of course, that makes perfect sense. You need reliable, accurate tools that you can take anywhere.
Right, of course. So maybe doctors aren't carrying around these handheld spectrometers to check meds in their offices just yet, but being able to get those quick, on-the-spot answers about the quality of a drug at any point in its life cycle, that could really smooth things out.
Oh, yeah.
And even, maybe improve how secure the supply chain is.
Absolutely. And of course, the big thing is making sure that these portable devices are just as accurate and reliable as those big fancy lab instruments. Validating them and making sure they're tough enough for use out in the field, that's crucial. But you can't deny the potential to cut down on delays and make quality checks way more accessible.
Right. Okay. So last but certainly not least, we got to talk about machine learning, AI. Everybody's talking about it. So how can algorithms and all that data crunching help us make sure our drugs are top notch?
Well, this is where we can really put those mountains of data that we're collecting throughout the entire drug life cycle to good use. We've got a source here, artificial intelligence in drug development, and it talks about how AI is already shaking things up in healthcare in general. It can analyze tons of complex biological data, make things more efficient. That's happening in diagnostics, all sorts of areas. And guess what? Those same principles, we can apply them to QC.
Yeah. Okay.
Imagine these AI algorithms going through massive amounts of QC data from different manufacturing batches. They're not just looking for those obvious red flags, those out-of-spec results. They're digging deeper, finding subtle patterns, connections that a human analyst might completely miss. They could even predict potential quality issues before they even happen. Maybe there's a slight variation in the environment or in the raw materials. The AI can pick up on that.
So it's not just about reacting to problems after the fact. It's about getting ahead of the game, preventing them in the first place.
Right. And there's this other area, high content screening. That's where we're looking at how cells respond to drugs. Very complex stuff. And they really emphasize the importance of sophisticated data analysis. That's exactly where AI shines.
Yeah.
It's like having this super smart analyst watching every single aspect of drug quality. 204/7, never misses a beat.
Wow. So taking all of this together, all these amazing new technologies, what kind of impact are we really talking about here? I mean, is this just some incremental tweaks, or is this something that could fundamentally change how we do pharmaceutical analysis?
Oh, I think we're talking about a complete transformation,
Yeah.
a whole new ball game. One of the biggest changes is going to be in terms of cost effectiveness.
Okay. Yeah.
Think about it. Microfluidics, that cuts down on the reagents you need. Then you've got the faster analysis times across the board. That's thanks to microfluidics and AI. That means lower labor costs. And portable testing, well, that could mean we don't need as much of that big, expensive lab infrastructure.
And it seems like speed is a huge factor in all of this. Almost all of these technologies promise to get us those results faster.
Oh, absolutely. Whether it's those super fast reactions happening in the microfluidic systems or getting instant results with portable spectroscopy
Mm.
or AI just crunching through those huge data sets automatically, all these technologies can drastically speed up the whole quality control process. And that's critical. I mean, we want to get those meds to patients as quickly as we can.
And while a lot of our sources focus on point of need testing within the manufacturing process, I could see how this could expand further down the line.
Yeah.
Maybe even playing a role in stopping counterfeit drugs, although our sources don't really get into that specifically.
You're right. That's a really interesting point. Right now, the main focus seems to be on making things more efficient, boosting quality within the existing system. But as these technologies get even better, there's definitely potential for a wider impact on drug safety and access.
Okay, so we've talked a lot about the possibilities, which are pretty mind-blowing, but we always got to come back to reality. And our focus today is also on seeing how these technologies are actually being used in the real world of pharmaceutical QC. So, based on what we've read, are companies actually using these things widely, and what kind of challenges are they bumping into as they try to scale these things up?
Now, this is where our sources are a little thin on details. We don't have a ton of specific case studies that show, everyone jumping on board and using these cutting-edge technologies in their everyday QC work. We don't have a lot of info on early successes, the big hurdles they've faced trying to scale up, or the big lessons learned from those early pilot projects. Not in this specific field, anyway.
Interesting. So it seems like the potential is there, the science is solid, but actually putting it into practice on a large scale, well, maybe that's still in the early stages, at least based on what we've seen.
Yeah, but we can definitely see the direction things are moving in. All of our sources really emphasize the need for solid, reliable analytical methods. Whether it's proving that different versions of a drug are equivalent, meticulously tracking down every single impurity to meet those GMP regulations, or running those thorough stability tests to make sure a drug stays safe and effective for its entire shelf life. I mean, it all points to this clear need for better analytical tools. And the fact that people are actively exploring and even using these technologies in related fields like diagnostics and drug discovery, that tells me they're going to make their way into pharmaceutical QC too.
And I imagine that taking something from a lab setting where it works great and then scaling it up to handle the huge volume of work in pharmaceutical manufacturing, that's got to be a whole other challenge.
It is, absolutely.
Yeah.
You're going to have to make sure that performance is consistent across a ton of devices, that the tech can meet those super strict quality standards and regulations that govern drug production, and you're going to need people who know how to run and maintain these advanced systems.
Yeah.
Moving from those well-established methods to these newer approaches, that's going to take careful planning and a really deep understanding of how reliable these technologies are over the long haul in a manufacturing environment.
Okay, so we've covered a lot of ground here. It seems like the future of pharmaceutical quality control is really bright with these new technologies coming onto the scene. I mean, we're talking about cutting costs, getting results faster, and even doing quality checks in ways we never even imagined before.
Exactly. And while the sources we looked at do a great job of explaining the science behind these technologies and their potential, we don't have a ton of info on how widely they're being used in the real world of pharmaceutical QC. That tells me we're still in the early stages of this transition, but it's definitely happening.
And that brings us to a final thought for all of you listening. With all these advancements in analytical science happening so fast and the pharmaceutical industry's commitment to quality and safety, what kind of unexpected uses or maybe even roadblocks do you think might pop up as these technologies become more and more ingrained in how we do quality control in the years to come? And how will those regulatory bodies that oversee this whole industry adapt? They'll need to find a way to encourage innovation while making sure patients are safe, which is always the top priority.
You're right. It's going to be fascinating to see how this all plays out.
It really is. This is where science, technology, and public health all come together. And with that, we've reached the end of our deep dive into this amazing world of emerging technologies and pharmaceutical quality control. I hope this conversation has given you some insight into the future of how we analyze medicines and ensure their safety and effectiveness. Thanks for tuning in,
Thanks for having me.
and we'll see you next time on The Deep Dive.